Lately in the news, we've been talking about people having resistance to certain antibiotics and how that may be fueling superbugs. Well, acne is actually directly affected by this as well. America's favorite dermatologist, Dr. Tess Mauricio, is here along with her patient Arnie with how new technology is providing hope for people that are dealing with chronic acne. Dr. Tess and Arnie, thank you so much for coming in. We do appreciate it.
Well, I think it's a big problem. 40 million Americans suffer from acne, and like you said, antibiotics can only provide sort of like a short-term treatment, and then for many people, they've gone to pediatricians, dermatologists, and they've already tried antibiotics and it doesn't work. What to do next? And that's really what I want to educate the public, is that there is that middle ground with your antibiotics and topicals and the strong medications. We're talking about Accutane or isotretinoin.
That can have a lot of side effects with that, so a lot of people are desperate to find something in the middle.
And we have that now, and it's different types of acne laser treatments where we really are addressing the skin, we're addressing the bacteria in the skin, we're addressing the oil glands. And I brought Arnie here because, it's always better to hear it from a patient who's experienced the psychological impact of acne. I've had acne my whole life, and
You've
how
had
it's
acne
better.
Yes. Talk about what you were dealing with, Arnie.
Well, for me, it's like hormonal. As a female, you always get to have like that sudden breakout where your pimple will just be like elevated, it's noticeable, and it's hard to hide even with like makeup.
Right.
Well, for me, I've tried a lot. My skin is really, really sensitive. I've tried those like creams, like the 3 steps, and all they do is just to like dry my skin. I'll peel, but acne-wise, it didn't help.
So you were having acne, now you're having redness, and you're peeling, and it's actually looking more irritated than it was before.
And then, so when I got my consultation, they said, like, we have this tri-beam. It's worth the try. They customized the treatment for me. We're
seeing the treatment happen right here on this video. Is it painful at all?
Well, they have a numbing cream that they provide you prior to the treatment itself. And for me, it's nice that how the team, they customize it for me, because I have really low pain threshold, so it takes forever for the numbing cream to take effect. But then they cater to it, and the treatment is very quick. It's painless after that numbing cream, and it's effective.
It's effective. You said within a couple of treatments you started to notice a huge difference.
Yes.
What did you notice?
After some treatments, when I break out, I would still break out. That's not gonna change. But the acne, it's not that active anymore. It's dry, and it would be gone after a couple of days.
So how does this work, Dr. Tess? What's the laser doing?
Yeah, so basically you saw there's the black thing that's charcoal that's applied on the skin. It's supposed to go down and be absorbed down to the oil glands, and then the laser is targeting pigment under the skin, so it will heat the skin, so it's going to kill the bacteria with the heat. It's going to shrink the oil glands that is feeding the bacteria, and in addition, you're getting resurfacing, so some of the discoloration, the redness, the acne scars, the large pores also improve with that. And this is just, before and after photos, it's really amazing. And we are treating both men and women, even teenagers. And I was just telling you, over the weekend, I treated the worst acne patient. And you can see this patient with severe cystic acne after a series of these treatments. It's life-changing. She's so much happier. They're so much more confident. And hormonal acne, a lot of women around menopause, like you said, you're having wrinkles and you're getting acne.
Wonderful.
And so this is, for all ages. The amazing thing is, for most of these acne laser treatments,
look at this guy.
There is absolutely no downtime, right? I mean, it's significant. And so if you are a parent out there and you have a teenager who is suffering from acne and you're noticing,
or girl, I think we need to point that out. Women tend to take a proactive approach, and our poor teenage sons are suffering with this. They don't need to be.
It does affect them. The poor teenage kid that I saw, he was really being bullied. He covered his head with a hoodie all the time. The teenage girls and women, they're covering themselves with a lot of makeup or hair bring them in. Let's educate you on what's available before you also put them on these really, really strong systemic medications.
Arnie, thank you for sharing your story. Dr. Tess, thank you for what you're doing, not only for men and women and keeping their skin looking young, healthy, and beautiful, but for also clearing up this problem that really can have a detrimental effect on folks' self-esteem. mbeautyclinic.com is the website. There are multiple locations. You got the list right there. Give Dr. Tess a call and don't deal with acne anymore. Put a stop to it right now. Thank you, ladies, for coming in. We certainly do appreciate it. For more information, go to our website, sandiegosticks.com. Click on San Diego Living.